Hello, my name is Nicole, and I am here to ask for your help. As cited by Volkoy, Frieden, Hyde, and Chai in 2014, 82% of all deaths related to opioid prescription drugs and 92% of all deaths related to heroin were unintentional. Early this year, a bill, HB 155, as listed on Virginia's Legislative Information Systems website, was passed by legislation that would allow for several cities in the state of Virginia to open opioid addiction facilities. These facilities would offer medication-assisted treatments as well as behavioral treatments. As Human and Health Services Secretary Tom Price stated, we are committed to bringing everything that federal government has to bear on this health crisis. Building partnerships and providing resources to state and local governments as well as non-government organizations are absolutely critical to this effort. In 2017, over $70 million to be used over a span of several years was given to fight this crisis. The money will help to treat opioid addiction disorder. According to Health and Human Services, $28 million of that funding will be used for medication-assisted treatment. In April 2017, as mentioned on the Health and Human Services website, $485 million in grants were given to all 50 states under the administration by the Substance Abuse and Mental Health Services Administration. The three grants associated with this funding are medication-assisted treatment and prescription drugs opioid addiction, in which $28 million will be given to grantees to increase access of medication-assisted treatments. First responders, in which $41.7 million to 30 grantees to train and provide resources to first responders on the use of Narcan, and improving access to overdose treatment, in which $1 million will be used to expand the availability of Narcan, in which we have all seen several drugstores are starting to carry Narcan at no cost to people who believe they are at risk for overdosing. Two additional funding opportunities were made available in May of 2017 that would help pregnant women and postpartum women battling addiction, as well as the communities. Since all of the funding has been given, and since the bill has passed, there has not been any funding provided for the creation of these opioid addiction facilities. My goal is to put into place a policy that would allow any person with opioid addiction, no matter their insurance status, to be seen and receive full services at no cost to them at these facilities. The services to be received would be visits, therapy, and medication. The pros of this policy would ensure that every individual receives the care they deserve. This policy also will have a decrease in emergency room visits due to overdoses. This will decrease the opioid addiction statistics in this area and will furthermore decrease the death toll in this area from opioid addiction. The con of this policy will be an increase to state and local communities and the government. The funding needed will be for the following: at least 5 to 6 facilities in the area, including the utilities, supplies, office furniture, computers, telephones, anything needed to run these facilities. Transportation, so that is an option for the addicted to get to these facilities. Staff, if not offered as a volunteer-based program. And marketing, which we would use to get the word out to the communities. The funding could be government acquired or privately acquired, but those who are fighting this terrible disease should not be responsible. This crisis has been identified as top priority according to Health and Human Services. They have 5 strategies to put into place, which include strengthening public health surveillance, advancing the practice of pain management, improving access to treatment and recovery services, targeting availability and distribution of Narcan, and supporting cutting-edge research. The opioid facilities would be staffed with physicians trained in medication management and behavioral therapy. Volkoy, Frieden, Hyde, and Shaw, 2014, stated, when prescribed and monitored correctly, MATs have proved effective in helping patients recover. The barriers put forth by private insurances will be eliminated due to no cost. Transportation could be provided to those who need to get to the facility. There may even be a chance for a primary and family doctor to be on site to diagnose other medical problems or do preventative screenings. Working together, both government and private, we can put an end to this epidemic. Join my voice in fighting for the funding for this project, and we can save many lives together. Thank you.